Okay, I think we'll go ahead and get started. This presentation is being recorded, so you can access it later or share it with colleagues if it's been helpful. I want to first thank you for joining us. We'll talk today about the MSU COVID-19 prevention campaign, sort of phase 2. If you didn't catch phase 1 a few weeks ago, that's okay. Hopefully this will still be helpful and have relative information for you. This webinar is, like I said, being recorded, and it is being co-hosted by the National Social Norms Center at Michigan State University, as well as the Health and Risk Communication Center. I will briefly introduce our expert panelists, and then we'll get into it, and we will have plenty of time for questions. So please do submit your questions at any time during the presentation, and we will do our absolute best to answer those for you. I'm Erica Filipich, and I will moderate today. I serve as the Director for Organization and Development for the National Social Norms Center. And our panelists today are Dr. Maria Lipinski, Professor, Department of Communication at Michigan State University, Dr. Dennis Martell, Executive Director, National Social Norms Center, Dr. Monique Mitchell-Turner, Chairperson, Department of Communication, Michigan State University, and Dr. Cami Silk, Chairperson, Department of Communication, University of Delaware. And with that, I will turn it over to Dr. Martell for a welcome.
Thank you, Erica. On behalf of Michigan State University, the National Social Norms Center, the Health Risk Com, we want to welcome you all to this second presentation that will include the formative research results from a survey commissioned by Michigan State University through the National Social Norms Center, including faculty from the National Social Norms Center and Health Risk Com. We know that this is a challenging time for all universities and all colleges as they make decisions about reopening and how to handle students both academically and socially. We're hoping that this presentation will give you some insight, even though it's particular to Michigan State's campus. We hope it will give you some insight and some knowledge about how we went about collecting information about our students during their stay at home, and using that to try to create messages that will help them stay at Michigan State University and be successful both academically and socially. We know there's a lot of challenges right now with around the country with students wanting to socialize as part of the cultural experience at being at colleges. And I know many of you are trying to make decisions. We're hoping that this will give you some of that insight. I do want to have a shout out to our funders, Michigan State University and the Anheuser-Busch Foundation for supporting the, not only the National Social Norms Center, but our work in trying to find out solutions and answers and formative research concerning COVID. And with that, I'm going to turn it over to Dr. Monique Turner.
Thanks, Dennis. Oh, I'm really pleased to be here with all of you, but the work I'm going to present was conducted by a large team of really brilliant people. I'm very honored to present it, but I certainly don't want to pretend at any point that this was a sole effort. There was probably about 15 of us on this project, many of whom are in the room today. COVID-19, as we all know, really presents a unique challenge, right? So we have got a virus that affects people in very different ways in terms of severity, depending not only, of course, on immunodeficiencies and other vulnerabilities, but of course on age. And then we are also asking of people to engage in long-term sustained behaviors that are against our very core as human beings. We're telling other humans to stay away from humans. That is, of course, what we need to do. But particularly on college campuses, it can be a really large ask. And I know at Michigan State University, a long time ago when we first started working on sending students home last March, we knew we needed to think about how to communicate prevention in the most effective way possible. Well, members of our team pushed forward and said, we need to make sure that these strategies are evidence-based, that they're theoretically sound. We only have one shot to get this right. And so we conducted formative research on our student body to understand them demographically, psychologically, and behaviorally, so that we could provide our communication team with the best recommendations possible. Of course, many of you know that we have now sent our students back home, but truthfully, it doesn't matter because we still have 3/4 of our students residing in East Lansing. They will still need to approach the campus at various times. And we certainly, as all of you on this call, we need to be able to invite them back. So regardless of when these messages will be fully launched, it's critical that we approach this from the most sound scientific way possible. All right, so our research was aimed at really examining the target audience and engaging in this deep formative research so that we could develop messages that would resonate with them, capture their attention, and psychologically connect with them. I'm going to present some of the results to you, and I broke it down into themes. So it's part and parcel for anybody communicating prevention and harm reduction that we need to understand the audience's risk perceptions. And when we approach risk perception, we on our team look at a theory called the extended parallel process model. And essentially, this means that we need to understand the audience's perceived threat, which is literally the product of how severe they find this virus to be and how susceptible they feel they are to it. And we measured those constructs and created a threat variable. But we not only need to know whether they feel threat, we need to know whether or not they believe they can do something to thwart the threat. So do they believe physical distancing will keep them safe? Do they believe mask wearing keeps them safe? But secondarily, self-efficacy is critical. Do they feel confident that they can do it? So we as human beings need to believe there are steps that can be taken and that we personally can do that. Now, when we look at those variables together, as you can see on the screen, we can break our audience down into 4 potential groups, right? When people perceive high threat, that's severity and susceptibility, and efficacy, as I described it, that's really where we would like our audience to be. They know it's serious and they know there are behaviors that they can do that will keep them safe. But the opposite quadrant, low threat, low efficacy, is a problem zone. There we would need to increase people's threat, make them understand the severity, understand the susceptibility, and of course, believe in these behaviors and the efficacy of them. Now, the other 2 groups are somewhat problematic too, but in different ways. When people have high threat but low efficacy, that can lead them to engage in some reactant and defensive behaviors. But our job as communicators is to enhance their beliefs in these behaviors, to empower them and make sure that that we can increase their efficacy. So the campaign would become an efficacy campaign. Now that 4th group, high efficacy but low threat. Research has shown that that will be a proactive audience and they may be likely to engage in these behaviors, but still they're not going to be the most proactive because they don't feel threatened. So where did Michigan State students fall out? With regard to mask wearing, 28.8% of our students, this is graduate and undergraduate, fell in the where we want them quadrant. They perceived high threat, they perceived high efficacy. So we can leverage these students as role models across campus. But in terms of people feeling low threat, this is a concerning group for us. We have 28.8% also in the low threat, low efficacy group, all right? And 33% in the low threat, high efficacy group. Now I've dug deep into these data And so I want to share with you that the reason we have so many people in the low threat groups is because they perceived low susceptibility. These students reported that COVID-19 is serious. They understood the severity of the virus, but they didn't believe it would be severe for them. Okay. Now, interestingly enough, and I'll highlight this later, many of our students in other portions of the survey did indicate that they understood the susceptibility of other vulnerable people on campus, including the faculty and staff and students with underlying conditions, etc. And they indicated they cared for them. So pocket that away for now. I'll come to that. But they didn't feel personally susceptible. So now we know that a goal of our messaging needs to be to talk to them about some of the unknown or outcomes that they could experience. We need to heighten that susceptibility. For the low efficacy group, we need to make sure they understand why we now know that masks work. We understand that early on in March, there was some mixed messaging about masks that we now need to clear up for some audiences. We only have 9% of students in high threat, low efficacy. So again, that becomes a goal of efficacy communication. These percentages change a great deal for physical distancing. I'm going to tell you right now that at least at our university, our students did not feel confident in their ability to distance themselves at all. 17.8% of our students now are in high threat, high efficacy. That changed quite a bit from earlier with masks. 39% of the students are low threat and low efficacy. They don't feel susceptible and they do not think that they can physically distance. So that is something that we need to pay great deal of attention to. Anybody walking through our precious town right now will know that our students aren't distancing. So that is a massive goal of any messaging. We have 23% that are low threat, high efficacy, and then 20% in high threat, low efficacy. So physical distancing needs to be something that we pay very close attention to. Now, the next theme of our survey that I'm trying to advance, and it won't. Sorry, for some reason it's not. There we go. Was norms. No surprise, we all believe in the power of norms. We understand that people often act in accordance with what they believe is common and socially approved of. So we measured some normative components as well. Now, I do want to say that 82% of our students overall said that most people they know are wearing masks. The majority of the people they know are also physically distancing, but it's much smaller percentage at 57%. Notably, our students, only about half of them, said that they were uncomfortable socializing with people that they know aren't wearing masks and they know aren't physically distancing. So even our students who are staying safe may still be engaging with people that aren't staying safe. With an infectious disease, we can't operate in that fashion, so we needed to know that. We measured moral norms, which is a unique kind of injunctive norm. Injunctive norms, of course, regard, do people that you care about, other people in your social circles, approve of these behaviors? And our data indicated that the vast majority said that people I know, people I love, approve of these behaviors. The moral norms questions are worded quite differently. They ask the students, what do they think personally is the right thing to do? Research has shown that when it comes to pandemics and infectious diseases, understanding what students personally find to be in concert with their own moral code matters in predicting behaviors. The vast majority of our students, 79%, said that mask wearing is the right thing to do. So we were interested in who's the 21% that said it's not. We needed to know this so that we could target that audience with some unique messages. And our research did indicate that they tended to be white, tended to be incoming freshmen, so they've not been to our university yet, and they tended to be male. Okay. What about with physical distancing? Again, 74% said this is the right thing to do. They know it's the right thing to do. That's good for us to know. Even if they're not doing it, it's important that we know how they feel about it. Who are the students that are in this 26% of lower moral norms? Well, they tend to be white and they tend to be incoming freshmen. So again, it could be that they haven't experienced our culture here yet, and they could experience some belief and attitude change when they become part of the MSU culture. As a prevention researcher and scholar, I also want to know barriers to change. We measured a number of barriers. I'll share some of them with you. Okay. So first off, we looked at what we would call like outcome expectations. And we asked questions like these that I'm showing to you. Overall, students did believe that physical distancing would help keep them safe in terms of getting COVID-19. They believe they'd be less likely to get COVID-19 if they wear masks. So those did not present as barriers, okay? But we do have some students that were concerned that physical distancing would make them become disconnected from people. Earlier research that the Social Norms Center has done shows that our students really care about being connected with other people. So this is a big concern to them. Relatively few students felt stressed about having to wear a mask, but some did indicate that it was stressful for them. We measured their perception of masks being stigmatizing, and 74% do not feel stigmatized by wearing masks. But our Asian students and our international students were the highest in perception of stigma. Okay. Now, at this point in the survey, we measured what our team calls positive psychological attributes that we can leverage in messages by connecting to those values and making the messages resonate with their psychological self. So we measured group orientation and concern for others. And we found that overall, our students scored very highly in having a group orientation. They're very collectivistic. These questions asked outright, is the group more important than the self? And they believe in the team, if you will. And they scored very highly in concern for others. Now, on this chart, you can see that there is some variance by demographic that we are paying attention to so that we can deliver targeted messages. But overall, this is really positive. We also measured source and channel. Some of this data is very MSU specific, but we needed to know how should we deliver our messages. So we asked them, what health information sources do you use? And then in a separate question, we asked them what they trust. So notice that family is where they get their information, but it's not their most trusted source. So that's not where they want to necessarily be receiving their health information. It's simply a case of the fact that they've been home since March, and that is where they're getting their information. In terms of trustworthiness, they want public health experts. They want the CDC. They want the Michigan State health educators. They want Dr. Fauci, right? They want our governor to talk to them. And our MSU president is an infectious disease scholar, and his name came up several times too. So we were really encouraged by the fact that the students want their information from legit public health sources. We shared different forms of evidence and asked them, how convincing is this argument to you? The most convincing argument of the ones we showed them was that masks protect vulnerable members of our campus. The second most convincing is that masks and face coverings are the most effective way to prevent COVID-19. But all of our arguments about physical distancing fell to the bottom of the pile. So right away we knew we've got a challenge here, because not only do they not want to engage in this, but they don't even find the arguments convincing. But that's okay. We're up for a challenge, but we needed to know in advance what we're up against. We measured their behavior, and we've shared some of these data before if you've been with earlier webinars. Currently, 65.6% of our students are engaging in mask wearing. Varies a little bit by demographic. 64.8% of them are currently engaging in physical distancing. Now, this survey was sent out during the summer. The students were mainly home. So when we were asking them about their current behavior, we're asking them, what are you doing at home with your family? So we also asked them, what do you plan to do when you get back here? With regard to mask wearing, 80% of the students said, I'll wear a mask on campus. I'll wear a mask to my classes. Now, at this point, we had not shut down in-person classes. We have now, but hopefully their intentions will stay the same for the spring. We may have to collect additional data. With regard to physical distancing, that number goes down to 73%. And it varies quite a lot by demographic, with males saying 72%, incoming freshmen are at 63%, Caucasians relative to others, 69% engaging in physical distancing. So there are some important differences to look at. All right, so here's what we did. Our team took these data, and as message scholars, what we do is we look at them and say, okay, what does this mean for the kinds of tactics and strategies that might be used? And I'll share some ideas with you, and then we're going to open it up for questions and comments, and the whole team will chime in. So for one, we know that we do need to deliver some targeted messages. Caucasian males, particularly in the younger incoming freshman group, may need some very tailored messages to increase their susceptibility. Based on what we know from this target audience, we're going to have to use some very authentic, credible stories, something that's not easily counter-argued. We're going to have to be active social media users to reach this young crowd. We're going to have to be careful not to cause psychological reactance, which manifests as anger and negative thoughts, right? Because this is a group that's telling us, we don't want to do this. We'll wear our mask. We're not going to be distant from each other. And they want this messaging from a medical professional. We're going to leverage norms. The normative data are very encouraging. These students say, yes, people I know wear masks and physically distance, and they actually told us, and frankly, I think it's the right thing to do. So we're going to take some of our iconic social norms messages that were created by not me, but people on this team, and we're going to put masks on them, and we're going to communicate some of the positive normative data to start shifting their perceptions even more dramatically. Collectivism is a key leverage point here. This is a group of people that cares about others. They care about others. They care about the group. They want to be part of a team. We know from other surveys we've done that Michigan State students care a lot about Michigan State. They believe in the brand. They believe in what we stand for. So we can leverage this to continue to communicate that even if you don't feel susceptible, you are protecting others. You're protecting your staff. You're protecting your faculty. You're protecting people you care about. Spartans care for Spartans. And that's a big part of our message and our tagline, which is "We will." This idea of using the collectivistic concept is supported by the NCHA 3, with the 2020 version, which showed us that 80% of our students said that they agree that we look out for each other. 90% of our students agree that they actively contribute to the happiness and well-being of others. Over 80% agree that MSU is a place where health and well-being is a priority. And 80% agree that they're able to adapt when changes occur. So, I look at these data and I think these are people that care about people, and we need to remind them of who they are. These are not villains who want to spread COVID-19 all over the place, even though some of their behaviors might seem that way. Here are examples of collectivistic messages that I just pulled off the internet. These are not messages we created. These are just examples so you could see how collectivism can be made salient in messaging. All right, final recommendation here, one more recommendation, is that this group of older adolescents is expecting to be the villain of the message. They're the ones that are spreading this. They're the ones that can't be responsible. The story of them being the villain is being spread on social media. It's been talked about in the New York Times this week, in the Chronicle of Higher Education. It's all over the place. Interestingly enough, our team had this discussion over a month ago. And we said, look, they're going to expect for us to say, stop it, stop it, stop it. You're hurting everybody. But our data indicates that they don't want to hurt anybody. They care about people. They care about MSU. So in order for us to flatten the curve and to get through this pandemic, we need to make them the hero. We need to remind them not of the harm they could do, but of who they really are. So one idea for messages is to make them the hero. Imagine messages with pictures of vulnerable people across campus, pictures of a faculty member, pictures of staff wearing a mask that just says, thank you for protecting me, Spartans. Thank you for thinking of me, Spartans. And what the research would indicate is that that makes salient that moral norm. And when that becomes salient, they'll be reminded of how bad they would feel if they spread this disease. We actually did measure anticipated guilt. I didn't present it, but our students said that if they found out that they had spread the virus, they would feel very guilty. So instead of just layering on the guilt and making them feel bad intentionally, let's remind them of how great they are so that they can avoid that. That's a strategy that we've been talking about on our team. It's different than the typical stop doing this, don't do that, The message I'm thinking of, here are examples on the web from other topics, right? Other issues. But these are just like messages that convey, I believe in you and I know you care about me. All right. So I hope that gives you an idea of the formative research that we collected, how we analyzed and interpreted the data, and the kinds of messages that could come out of that. Though certainly I didn't give you an exhaustive list of recommendations. And at this point, I not only want to thank our team and our sponsors who are on this slide, but I also want to invite all the teammates to come on to answer questions and to engage with our participants today. So thank you.
Thank you so much for sharing that. Really interesting data. There's been a little bit of conversation in the chat and a couple questions. So we'll let people kind of catch a breath and think about that and let us know if they've got anything else. And Dr. Turner, this might actually be a question for you. We had a question. A lot of campuses have really robust peer education programs. And so the question was specifically to the survey question around where students want the information. And the health educator question, was that specifically asked about peer health educators or just as the slide read? If you could shed some light on that.
We did not specifically ask about peer health educators. We did ask about having other MSU students appear as like spokespeople in messages. That's different than what you asked about. And they did not emerge as a top spokesperson. They wanted to hear from health experts. We didn't ask about the peer model though.
Certainly understood, as MSU does not have a robust peer education program. I know a lot of universities do, and we do not currently. Anything else that the panelists might want to add around We have just different campuses represented. If there's anything related to what you think might be the top message folks might be or avenues might be.
Maybe Cami Silk, who's at University of Delaware, could tell us a little bit about, I see in the corner, there's a Protect the Flock icon over her head, which is really cool. Maybe she could tell us just a little about their experience.
Sure. So we collected data, not as specific as what Michigan State did, but added on to another survey and just measured some social norms types of things. And then we were working with the Office for Communications and Marketing and Student Health and Wellness at UD to come up with some ideas and sort of help them think through what of the injunctive norms, like the kinds of positive things that students approve of, like mask wearing and social distancing, might be useful for the campaign. So we had a little bit of a process and a bunch of meetings. And then the concept was around the collectivist idea of protecting the flock, since our person, I got to get it right here with the Zoom, is the blue hen. And so now, in terms of disseminating this, since we only have probably, and I'm not sure if these estimates are accurate at this point, things seems to, there's some summer melt happening, but there's also unclear how many people are actually off campus and on campus in housing at this point. But on campus, I think we've got somewhere between 1,200 and 1,500 students, which is a bit less than what they anticipated. And then off campus, anywhere from 10 to 13,000 students. So there's a big social media push for this. And so I've seen it kind of everywhere, and they really do have a pretty good tried and true mechanism for UD Daily and announcements coming out. And if you just go to the website, a lot of things pop up. Now you can download posters for faculty members to put. You can download this for your background, just different things, so that where students are going to interface with us are in classes primarily here. So like online classes, virtual classrooms. So having this is one of the best ways perhaps to reach them, is in the virtual classroom through these backdrops.
And I think this might be a question. Right now, it's certainly salient to MSU. It may become more salient to other institutions as we progress this fall. So the question is specifically around, with students online and decentralized at MSU this fall, how are we planning on disseminating these targeted messages? And I know we have just learned in the last 5 days, 6 days, that we're pivoting, making that big pivot. So we are also still working through a lot of those questions. But I'm not sure if anyone specifically on the panel wants to talk about this, or if I can maybe start with Andrew Poole, who's part of our National Social Norm Center staff, if that would be okay to toss to you on that one.
Sure, and it's a good question. I've been in a lot of meetings for the last month and a half preparing for the reopening, and then it was decided what was it, a week ago now, a week and a half ago, that now we're all virtual. But that doesn't mean that there weren't already a bunch of students who had already signed leases, some as far back as last October, who had already moved into town or were planning on moving into town. And this week they are here. So we have about 20,000 or so students off campus. And it turns out there are even some freshmen who normally have to live on campus who decided last minute to find a living space in East Lansing. So it is a new challenge for us. A lot of our best avenues from our research, when we do our other surveys, our You Celebrate survey and NCHA survey, where we were able to evaluate some of our messaging, some of our best messages come via avenues that are not open to us right now. Things like table tents and stall stories. Stall stories we can still do on campus, but there's only like 3,000 students that are going to be on campus. So we are actively working to find some of those new avenues. We will be utilizing social media. The nice thing is, because there has been so much planning going on between us and the city of East Lansing, more so to prepare for students coming back than ever before because of the unique situation. There are a lot of channels that have been opened up as far as partnerships that we were able to utilize. So we already have a pretty robust masking and social distancing, hand washing, and avoiding large gatherings campaign using Sparty that's posted both on and off campus, and the messages are the same on and off campus. They've actually printed aluminum signs that are posted in downtown East Lansing because they've matched MSU's outdoor mask wearing policies to create consistency across the downtown area and the MSU campus. So as we work to develop this campaign based on the data, because the first campaign was kind of developed before all of the data had been analyzed, we will work with our partners in MSU Communications to utilize those channels and hopefully use some of those same spaces to use this new messaging.
Can I just kick into gear here for a minute? So for all of you out there, you remember when Monique was talking about reactants and how it can make people do the exact opposite of what you want them to do when they feel you're limiting their freedoms. And one of the beauties of the duck campaign, or the blue hen campaign, I think that's what it is in Delaware, is that when you have a spokes duck or a spokes hen, you really eliminate a lot of the feelings of reactants. Now, I know it isn't what Monique said, that you've got the national scientists coming out and giving the messages, but in reality, it does help, because I think that people who receive those messages don't feel like some adult in charge is trying to tell them what to do. So that's one of the beauties of that kind of a campaign.
So, so one idea that we had talked about as a group a few weeks back was this idea of high reliability organizations. And, you know, I kept thinking about this old project we had done with hospitals and medical errors. And there are certain organizations that are considered high reliability organizations. You want to think about air traffic controllers or nuclear power plants or hospitals like we were working with. And the idea there is that these organizations have to have incredible safety protocols, lots of training, lots of compliance issues, and that is not how universities function, right? But yet we need to really respond appropriately to COVID-19. So we're really in a conundrum with this. And so when we think about why is this so hard, I think this helps provide a framework for thinking about it, because we're not the types of organizations. We're large, we're unruly, we don't have the training and those types of infrastructures in place to manage this very easily. So when you're thinking about why is this so hard and why can't we do this, I think this is a really important kind of concept to kind of explain to others, but also to give yourself a break a little bit too, because it is really challenging.
Really interesting. Thank you for sharing that. I'm going to go back to the survey, if that's okay. We've got a question related about the questions in the survey. Did the survey that you presented only target wearing masks and social distancing? And do you have any data regarding hand hygiene and disinfecting?
The survey did primarily target those two behaviors because that is what our chief medical physician here and others really wanted us to know most about. Certainly, I think, I'm trying to remember, we did ask about a variety of other behaviors at one point, but those each only had maybe like one indicator, whereas we have several questions on masks and physical distancing. At one point we had a bunch of behaviors and then we had to shorten the questionnaire. So the answer is yes, our focus really was masks and physical distancing, because those are the two primary recommendations on our campus. So there's your answer.
I would say there is another series of studies ongoing where there's other risk behaviors as part of that study that this team here has been working on as well, but that's national data as opposed to campus data.
Yeah.
Anything else that our panelists might like to share and sort of maybe some last minute thoughts? At this point, I think we've answered our attendee questions. One housekeeping note, we've gotten some questions about the presentation. As a reminder, we will post this to the National Social Norms website, and we will send the presentation out to everyone that registered. So any other final thoughts or suggestions for campuses that might be navigating how to really resonate and engage with their students?
I'd like to provide another thought, but it's not my original thought. I think I read it in a newspaper article. I can't even remember the source, but it's not me. But, you know, when it comes to physical distancing, as I mentioned at the top of the hour, we're really asking people to fight against very human nature, the very reason they came to Michigan State, right? There's all these things. And so I don't want to pretend like communication is a magic bullet, right? This has to occur with other good structures, right? So for example, there's one university that realized that because students were saying we're not going to stop distancing because we want to see each other, started really amping up safe social activities on campus. Like they're showing movies on a jumbotron in the football stadium and putting like markers where like to keep the people distant enough, and they have to wear masks to get in. But they're recognizing, okay, these folks want to see people. Let's work with them, right? Let's go down the same tide, right? The stream of the river instead of trying to swim upstream, and think of ways to work with them. And I think that that's really smart. Communication can only do so much without good physical structures, in my opinion. I don't know if the others want to jump on that, but we have to combine this with other activities.
I think that's a great point. I think it's you're in a unique situation. So if you allow for these unique events to happen that would not happen otherwise, I think it creates some novelty, and maybe you can get some participation when you might not otherwise under normal circumstances.
Right. Well, and now they're at home doing distance learning. So they're in their apartments potentially all day. And so, you know, we've got to recognize, well, we do recognize because we've been in our houses all day. So, you know, that they need to get out and do other things. So that's part of the recommendations we will provide to the campus, is to be thinking broader than just what messages, but what things we can do.
Can I add just one thought that's a little bit different from what we've been talking about, and that is, Monique mentioned it at the beginning, but I'd like to just reinforce. We discussed whether or not presenting our formative data would be useful for people on other campuses, and we actually had a big discussion among the team about whether that was even a good idea, because we weren't sure whether it would be helpful or, you know, how that would be construed. And one conclusion that we came to is, you know, we all come from this approach that the way you design communication campaigns and interventions is through finding formative data. And it may be that that's primary data, but that doesn't have to be primary data. So, I would just encourage people who are part of this conversation to think about, you know, you don't necessarily have to collect primary data from your population to be able to start to understand how they perceive the risk, what the norms are around certain behaviors, et cetera. You can use the stuff that we presented here and extrapolate from that. You can also use, there's lots and lots of studies that have looked at how people of this age perceive and understand a variety of risks. So you can also look to that data and information as a way to help you make decisions. So I would reinforce that again, as Monique pointed out at the beginning of the call.
You know, this is related, but not exactly, and it might sound a little off, but I'm thinking of some old farmer research right now with sun protection behavior. And what we wouldn't do is ask farmers to stay out of the sun, right? We would never think of asking them to do that. What we would ask them to do is adapt their behavior, to wear a hat, to wear long sleeves, to use shade, to use sunscreen, to maybe try to stay out during the peak hour or two, which is really unlikely. So similarly, we really can't ask the students the very reason they're there to connect to not connect. So if we take it out of this current context, I think we can maybe even relieve some of our own anger or outrage at students for not engaging in behavior too, in the recommended behaviors. So these are behavior adaptation models that we're talking about, and asking students to adjust slightly is a little bit better than tell them just to stop doing something. So just came to mind when Monique was talking.
Yeah, no, Cami, you're completely right. Because in the beginning, in some of the conversations we were having, we were remembering tackling HIV, right? Asking people to not engage in sexual activity, or even with some populations to always wear a condom wasn't working. These were just messages that they would not accept. So, which really brought on the harm reduction strategies that are used today, right? What is a safer way to do this? What is a safer way to socialize? And I think that we cannot forget everything we've learned from other infectious disease. I mean, we're not inventing the wheel here. It's a new wheel, but it's still a wheel.
So we do have another question related to norms, and since we spent some time talking about that. So the question is around designing social norm messages. Would you suggest focusing on injunctive norms, especially the moral norms that were mentioned, or both descriptive and injunctive norm messages? So I don't know if Dr. Smith or Turner or maybe even Andrew wants to kind of talk to that question. So better to focus on injunctive norms, the moral norms, or both?
That's a Sandy question.
Well, I think that the question, my answer is it depends on your population and what, if you can do some formative research, what you think is going to resonate with your population. So do they need to think that the majority of others are engaging in the behavior, therefore it's good? Or do they need to think the majority of others approve of them engaging in the behavior, therefore it's good? Or the moral norm? And I think also that you could mix it up as we do on the alcohol campaigns that we run on campus. So I'm not sure, I think I saw that question was from Rain at University of Arizona, if I'm not mistaken. So Rain, maybe you can write to us, back channel. Rain got her PhD at Michigan State, for those of you who are in the audience, and tell us if you have money to do some formative research, or if you have done some, and we can answer your specific question. That goes for everybody else too who's in the audience. If you would like specific questions answered by any of us, please feel free to reach out. That's one of the things we like to do.
And just to add on to that, I think when it comes to the messaging you're doing and deciding between injunctive and descriptive norms, I think, and this kind of ties in with maybe another question we're getting here, if the policy at the university is 100% masks all the time in and outside of buildings, then it's difficult to do a descriptive norm, even if you have great data on it, where 88% of students say that they're going to wear their masks. So if you have some messages that you can develop around some of your injunctive norms about what students believe is the right thing to do, that might give you a better attitude, a better avenue towards creating a message that's going to both be effective and not be in conflict with what your policy is.
That reminds me of something. Andrew just was talking about environmental management. And in this case, there's a lot of environmental management that's going on in terms of policies and laws and rules that are put into place with very strong consequences already. And Cami, I think, has alluded to this a little bit. I mean, we might be bumping up against, a lot of students are getting basically ejected from school for some of the behaviors. And so I think that we have to really have a lot of knowledge about our own campuses and what's going on and what are the environmental management policies that are already in place. As Andrew said, I wasn't even thinking about that, but why message around mask wearing on campus if it's already a rule there?
Right. Yeah, and it's very interesting to see all the stories across the country on how different universities are handling things differently. And, you know, one university have a bunch of suspensions, other universities decide to shut things down. It's kind of a hodgepodge, and we're all kind of figuring it out as we go.
Okay. So I think we've gotten to everyone's questions. Is there anything else for this afternoon that we want to share with our attendees? That was a great conversation. Thank you. Okay. All right, so then we will wrap up. Again, we will post this. We will send it to you if you had signed up as an attendee, so you can reference it. And as Dr. Smith suggested, please email us, reach out to us if there's any questions you might have or anything we might be able to help you as you navigate. We're all kind of in this together, right? So thank you, and all the best on your campuses this fall.
Thanks, everyone.